now we have a test and a test result. And the interpretation of that test result isn't always straightforward, especially as the science is changing so rapidly. To be able to tell that pair, with this result, I can now order this treatment because it's the appropriate treatment. In fact, there was a paper published in JAMA last year that said even with the genetic testing information, providers are getting it right about half the time. And so knowing that, the next step is, okay, now I have to get the right treatment for my patient. And I'll have to go to either a PBM or another part of the company that's doing medical pharmacy that might sit apart from the rest of the company, say doing the surgical management of the patient or the radiation management of the patient. These are not all tied together in a holistic type of experience for anyone. So back to the drug example, if we then go to the plan and say, this is a treatment I want. So the plan will review it and will say, oh, we can't approve that without the testing. And so you have to go back and get the testing. And it just becomes very discombobulated along the way for everyone. It's not efficient. In the background, you know that patients and families are worrying about the time that it might take to get through these processes. And we want to make sure that the knowledge about what is the best set of treatments for this individual is always kept to the forefront so that we can get to the best outcomes. So if you look at all of those different pieces along the way, I think the solution becomes really obvious, which is that you need to centralize the testing all under the same hood so that that provider is dealing with one organization to get the testing approved, ordered into the system, and relating and tracking to the pathway of treatment that's the best pathway for that individual.